Good day, everyone. My name is Mary Bernadette M. Rigacho, a third-year forensic science intern of the College of Criminal Justice Education in the University of the Cordilleras. I am here to present to you my study entitled The Prevalence of Mental Illnesses Among Prisoners in the Baguio City Jail and the Interventions Being Provided. Addressing mental or psychological illnesses among jails and prisons has been long disregarded all over the world. So first, let's define the keywords that are mostly used in this study. So prisoners and inmates were used interchangeably in different contexts without keeping in mind their humanitarian rights. Last 2017, the Bureau of Corrections implemented the Mandela Rule. The Mandela Rule is what makes the inmates called persons deprived of liberty or Pdls. Coyle in 2005 defined prison as a place for punishment of criminal acts, protecting the public from crime and criminals. Mental illness, as defined by the American Psychiatric Association, is an health condition that is correlated to the changes in emotion, thinking, or behavior, or combination of these to a person. It is also associated with distress and/or problems functioning in social, work, or family activities. The World Health Organization also categorizes depression, bipolar disorder, schizophrenia, and other psychosis, dementia, and development disorders, including autism. So studies from Western countries, like from Diamond et al. In 2001, reported that the prevalence of mental illness in prison is higher than in general population. Here in the Philippines, there are 933 prisons nationwide, leaving 215 prisoners across the country in 2018. Philippine jails have become more compact, giving less space to each prisoner. Here in Baguio City, Philippines, the capacity of the female dormitory is 100% higher than its ideal capacity of only 50 Pdls. Meanwhile, in the male dormitory, there are 474 Pdls and is 400% higher than the ideal capacity of only 100. The said ideal capacity of jail is based on the United Nations standards, and with that number, the Baguio City Jail is already congested with 120% congestion rate. In the publication of the World Health Organization entitled Prison and Health, in collaboration with the Red Cross International, they listed overcrowding as one of the factors that negatively affects the prisoner's mental health. Pre-prison adversities, various forms of violence, enforced solitude, lack of privacy, lack of meaningful activity, isolation from social networks, insecurity about future prospects, and lastly, the inadequate health services were other factors. Prison environment were also reported that contributes to the development of mental illness of the prisoners. The researchers aims to know how many Pdls are experiencing mental health issues while serving their sentence and how other factors affect their psychological capabilities. The researchers would want to improve and give assistance programs and provide tools for the Pdls. The researchers use a qualitative approach of the study. Male Pdls of the Baguio City Jail were selected to be the population. 293 male Pdls were given the simple survey questionnaire for the survey type using a non-diagnostic approach. The 12 questions on the survey were used from study in National Institute of Justice. The simple survey questionnaire were used to collect data from the respondents' personal information such as name, age, and their sex, but it is also optional. So for the results, since the researchers used a descriptive approach, a complex table were used to summarize the data gathered, and based on the results and discussions on the information collected from the participants, specifically their age, the researchers calculated the percentage of the results of the questionnaires based on how many voted for yes or no. Out of the 12 questions, only 4 questions were answered yes by majority of the PDLs. Out of the 12 questions, only 4 questions were answered by majority of the PDLs, and the remaining 8 questions were answered no by the majority. In the table showing how many PDLs answered yes or no, based on their age, PDLs ages 18 to 21 and 22 to 39 years old has the larger number of who voted yes on the questions, indicating they are more common to have mental illness compared to the 30 years old and above PDLs or the older PDLs. For the conclusion, mental health issues among persons deprived of liberty should not be neglected by the correction administrators. Based on the conducted survey, only few PDLs are experiencing some psychological difficulty, which should be given assistance that would improve their mental health. Having only male PDLs of the Baguio CCJE limits the results of the study. Hence, the prevalence of mental health problems is varied by age group of the population. Inmates ages 39 or younger had the highest rate of experiencing mental health problems, and those 40 years old and above had the lowest rate. For the recommendation, having a good and accessible healthcare facilities inside the correctional institution could be a good start in changing the way mental health problems are being addressed. Treatment like therapies, medications, educational activities must be clinically justified and is science-based. Therapies that must be given to the PDLs must be in line to their diagnostic and their needs. Another recommendation is mental health awareness training. This training should not only be for the staff, but could also work in the PDLs themselves. PDLs could learn a lot from that mental health awareness training, from managing their own psychological capabilities to also how can they help their fellow PDLs in having healthy or stable mental health. For the next recommendation, maintaining healthy social networks may improve a prisoner's mental health. Detailed screening and assessment at the arrival of the prisoner must be implemented in city jails in order to properly address the needs of the prisoners before going inside. Deep screening is needed, or at least having at least 3 to 4 days observation could help in preventing and also help the prisoner in adjusting to their new environment. More extensive staff of law enforcers and health officers could help in the management of mental health problems they encounter inside the facilities. As for the researchers, increasing the sample size and having female PDLs may enhance the results of the study. The researchers were limited to only male PDLs because of the pandemic. Using other design and methodologies may also be helpful in exploring other perspectives in the study. Interpreting the data using other factors aside from age group could greatly help in the understanding of mental illnesses among prisoners. And that is all for my study. Thank you for listening.